Hello, my name is Shawn Lewis. I am the nurse manager in the emergency department here at South Pointe Hospital in Warrensville Heights. Today we're going to be presenting our simulation for our trauma simulation here in the ED. About a year ago, one of the nurses came up to me and was saying that she had a lot of concerns about our newer graduates who were coming into our emergency department, which is not a trauma-rated ED. We do get a lot of trauma here, 60 to 80 gunshot wounds a year, and we did not have a lot of experienced nurses working on those traumas. This nurse came to me and said that during a recent trauma that the nurses seemed unorganized and didn't really quite know what to do. We weren't as well practiced as we are with a code, ACLS, something we do very often. So her ask to me was to see if we could practice more with these trauma simulations. I was intrigued by this and reached out to the simulation team, and we decided to put an actual sim together where we could review and teach the team to work better together in these situations and get defined roles, and everyone was on the same page. So I worked closely with Maria Roznik in nursing education. We utilized a trauma simulation we had used in the past during competencies for ER, and we got this together. We decided to do a 22-year-old victim who arrived via EMS, who fell off a ladder after being shot. It seems a little odd, but this is the type of trauma we get here at South Pointe. We do get a lot of walk-in gunshot wounds, so we wanted to make sure that it was as realistic as possible. And next, we reached out to our team here in the ED and got a lot of great feedback, and everybody wanted to be involved. We got paramedics and nurses both to sign up for it, and we had about 6 or 7 people in each of these sessions. Really good turnout during the sessions. We tried to make it as realistic as we could. They gave a fake ambulance call in. We had multiple injuries to the patient, including blunt force trauma to the right upper chest. There was a tension pneumothorax. There was a fractured ankle, which we tried to get people to be distracted by, but they were not. And we had a gunshot wound to the right lower abdomen. Our goal here was to see if the team would focus in on doing the primary and secondary survey correctly. And we were actually very happy with the outcome. The teams worked well together. They communicated well. What we thought was really great was the experienced nurse or two that was in the room really helped to guide the new nurses and show them what they needed to do. They also followed the primary and secondary survey fairly well. Doesn't hurt that prior to the presentation, we had sent out pre-work to study the primary and the secondary survey. And Maria was also kind enough to bring a large poster we put on the wall as well. We were very concerned that the distracting injury would take precedence over the bleeding in the abdomen. And they did not. The team actually prioritized circulation in the ABC. They put that C back in front of A like they should. And both teams focused on the circulation and stopping the bleeding immediately. So very happy to see that. After that, they did walk through the ABCs all the way through into the secondary survey. We wanted to throw a little extra in there. You can see in the middle here on the bottom, there's a picture of a fake 3D printed gun. We did want to see how the team would react finding a firearm on our patient. And when they did the secondary survey and rolled the patient, both teams found this weapon. It was interesting to see both teams actually grabbed the weapon and moved it themselves, instead of calling for Cleveland Clinic Police to physically remove the weapon. We did debrief about this and asked that moving forward, that they utilize Cleveland Clinic Police to move or touch any firearms just to help maintain their safety. Overall outcomes, this was very well received. The simulation went well. 2 teams of about 6 people. We spent about 20 to 25 minutes each. Very realistic, great feedback from the teams, great feedback from the instructors. Very happy to have this opportunity. Thank you to the simulation team for allowing this to happen. We look forward to using more of these simulations in the future.